I developed a tremendous amount of pain from my shoulder down my neck and into my upper arm area. I really couldn't carry on any normal kind of activity. I even had a hard time reading or using my laptop or really anything. So I did what I always do, which is I usually get chiropractic care, and it seemed to has maintained my neck over time, but this was so severe, the chiropractic care just didn't touch it. I actually went for a month of chiropractic care and spent a lot of money and really didn't have any relief at the end of the month. And so that is when I went to a family physician who then ordered up the MRI, and then I ended up at Dr. Kremer's office. Spent probably an hour and a half with my husband and I, which we thought was very unusual. And he went over my MRI, had models that he used and to show exactly what my problem was. He was very educational, extremely thorough, and extremely compassionate because I was in a lot of pain.
When Jennifer came to see me, she was struggling with pain. She had tried a number of different things to get better, things that other people said would make her better. And a lot of people do get better with physical therapy and chiropractor. But it wasn't until she saw me and I was able to review her cervical MRI that we started to understand why she hurt. So a weak joint at one joint in her neck, C5-6, not only caused problems with the C5 and C6 nerves, but also affected C4-5 and C6-7. So one bad joint leads to a deformity, which then affects how the other joints function. So the arthritis in one joint accelerates the degenerative changes in the other joint. By restoring the curvature to her neck, the weight, the load would be more effectively balanced. It would be a more energy efficient posture. Not only does this lead to less pain, but the other joints, the remaining 5 joints in her neck, are now able to function better. She has a more functional spine now as a result of surgery, not less.
Dr. Kremer was so thorough, really explaining what to expect, not only, during the surgery, but also post-surgery, and how I would heal and what I could expect as far as my activity. And he was very reassuring. I'm at full level of activity now. I can do really anything that I want, including kayaking, and I'm riding my bike, and I can go swimming and spend time with my kids and my new granddaughter, and I can do really anything I want. I think what I appreciated most about him was after the surgery, my family were there after the surgery, and he spent 45 minutes with a whiteboard and different color markers and drew out exactly what I had done, and spent a good amount of time in his surgical gown and cap explaining to them exactly what I had done. And it was, I think, really a top-notch surgical experience. He promised to not only correct the curvature, but to clean up all the deterioration. He said I would be better off afterward, and I definitely was. Yeah, I feel like I gained about 20 years of youth in my neck, at least.